The broadcast is now starting. All attendees are in listen-only mode.
In the interest of time, I'm going to begin right away. Good afternoon and a warm welcome to everyone. Thank you for joining us for our ongoing webinar series on COVID-19 and related issues that is hosted by the Michael and Susan Dell Center for Healthy Living here in Austin, Texas. Our vision at the Center for Healthy Living is healthy children in a healthy world. My name is Nalini Ranjit. I'm an associate professor of health promotion and behavioral sciences here at the UT School of Public Health in Austin and a faculty member at the Dell Center for Healthy Living. Today, I have the pleasure of introducing our esteemed speaker and my good friend, Dr. Andrew Springer, who will share with us his ideas and rich experience with health promotion interweaving. Before we get started, I just want to make some housekeeping announcements. First, this webinar is being recorded and it will be archived along with the presentation slides on our website at msdcenter.org. Second, if you have any questions during the presentation, please enter them into the chat box. We'll have some time for Q&A at the end of the presentation. And now to introduce Dr. Springer. Andrew Springer, who's a doctorate in public health, is a tenured associate professor of health promotion and behavioral sciences at the UT Health Science Center at Houston School of Public Health at the Austin campus. He has over 20 years of experience in designing, implementing, and evaluating child and adolescent health programs. In addition to his faculty position at UTSPH, Dr. Springer holds an adjunct faculty position at a university in Cali, Colombia, where he has been teaching a health promotion planning course in the Master of Health Psychology program since 2015. In his work, Dr. Springer embraces an active community health praxis, which includes his current role as co-chair of the Community Collaborative for Child Health and service on community health boards that includes the Austin Travis Community Health Improvement Plan, as well as Children's Optimal Health. His research focuses on child and adolescent health promotion, with a specific interest in social ecological influences on physical activity, as well as health risk behaviors in young people, in addition to participatory health planning and evaluation methods. Among his current research projects, he serves as the PI of an evaluation for the Del Valley Healthy Adolescent Project. This is a community partner-led project aimed at enhancing the ecosystem of supports for adolescent health promotion. In today's talk, Dr. Springer will be speaking on health promotion interweaving, an idea and theory that has been central to his work for several years, and that he recently elaborated in a very well-argued paper published in the online journal Frontiers in Public Health. I encourage you all to read that, it's freely available. Please join me in welcoming Dr. Springer as he shares his innovative vision and ideas for weaving settings and environments into health promotion efforts targeting the community. Thank you very much, Dr. Springer, for joining us today. We're all looking forward to your presentation.
All right, well, thank you, Dr. Ranjit, very much for the kind introduction. And again, warm welcome to everyone, and thanks so much for joining us today for the Dell Center for Healthy Living webinar. So today I will be speaking on health promotion interweaving, designing health promotion interventions in context via youth voice and community partnerships. For today's session, I'll begin my presentation by touching on place, settings, and health to underscore how our health and behavior are products of our environment and how we need environmental change theory and practice-based methods to guide interventions that specifically target the environmental context. I will then introduce and provide an overview of environmental asset mapping and health promotion interweaving into environments and settings, which aim to explore how we can embrace greater intentionality in designing our health promotion interventions in concert with context. I will then illustrate the power of identifying and co-creating environmental change via stakeholder input based on recent work with the Youth-Led Community Health Learning Initiative. And lastly, I will share some of our work with Stronger Austin, which embraces a partnership approach for interweaving adult fitness classes into community settings. So let's begin with sharing just a few findings on the influence of place and settings on health and health behavior. So I begin this session with sharing some intriguing findings from Dr. Raj Chetty and colleagues on the influence of place in shaping our life expectancy. So in this study of national data from the US between 2001 and 2014, Dr. Chetty and colleagues found several key findings. First, First, they found that, not surprisingly, that higher income folks had more years of life that they lived. Notably, they also found a widening in the gap of life expectancy between those at the top of the income bracket and those at the bottom. So around 15 years for men, folks live longer if you're at the top, and 10 years for women. A second key finding was that inequality in life expectancy increased between 2001 and 2014 in the US. So those at the top lived about 2 to 3 years more in life during this time, and then those at the bottom, no change in their life expectancy. So importantly, and in relation to the session today, they also found life expectancy varied by geographic area for low-income individuals. So, for example, if you live in Tampa, Florida, you might live, and you're poor, you're experiencing poverty, you might live less long than those who are poor and living in San Francisco. And they found that was due to some of our usual suspects, so at the individual level, healthy living related differences, so due to smoking, physical activity, and obesity. They also found geographic characteristics or area characteristics of living in a place with more college-educated people, with more immigrants, and with greater government social expenditures was related to longer life. It didn't have to do with, however, access to health services or income inequality, and of course important exposures for our health, but in this analysis, those did not surface to be key factors. So they concluded that where you live, area characteristics and individual behaviors predict how long you live. So beyond place, there's growing evidence that shows that our settings also shape our health and health behavior. Those settings might be our workplace, faith-based institutions, as well as schools. So in our own work on obesity here in Central Texas, we analyzed data from the Catch Middle School project. We had about 2,600 students in that study, 8th grade students, and we asked ourselves, how does a settings effect change our understanding of obesity? So normally we've seen a lot of findings that Hispanic and African American children and adolescents have higher prevalence of obesity compared to white kids. But when you layer on a settings effect, here are data of obesity by school socioeconomic status. And what we find is if you're African American and you attend a school with lower economic disadvantage, we found that you had similar obesity prevalence as your white counterparts. And conversely, if you were white and attended schools with higher economic disadvantage, you had about the same prevalence of obesity as African American students. And we found similar patterning for obesity by school SES for Hispanic students. So we looked again at the settings effect with research on vaping. And let me first just give a shout out to Dr. Steve Kelder, who's been, along with Dr. Deanna Helcher, been leading our work on Catch, which is a school-based health promotion framework. So with our Catch My Breath study, we had data on around 3,600 6th grade students. And at first pass of our data, we found that look like Hispanic students, right, might have higher susceptibility to e-cigarettes. But when we layer on a school SES settings effect, we actually find few differences between white and Hispanic students depending on their school SES. So we saw lower prevalence for lower economically disadvantaged schools and then higher prevalence among higher. So pretty much no difference between whites and Hispanics when they're within the same school. So directs our attention more not to the racial ethnic differences, but to that school setting effect or school SES differences. So an important question for us health promotion practitioners and researchers is how can we harness that space outside the individual for health promotion, if indeed our health and health behavior are a function of our environmental context? So in our field of health promotion, we embrace theory. And the good Kurt Lewin, the father of action research, once said there is nothing more practical than a good theory. And indeed, theory provides that map to help us understand why people engage in a given behavior. And it also provides conceptual frameworks to guide our intervention work. So unfortunately, a lot of our work in health promotion has built from individual level theory. Secondly, at our community level, we often don't see as great effects. So Penelope Hall, in a seminal paper on complex interventions, explored further why did we see, for example, in some of these primary community level interventions around risk factor reduction for heart disease, such as Stanford Heart Disease Prevention Project, why do we not see such impressive effects? So she concludes that one, many of these interventions fail to address the context within which individuals live. And secondly, that we would apply individual level behavior theory to community and system level processes. Another key paper from Warren Evans, published in 2017, had some of the same conclusions. So they noted within our field of health promotion, often an over-reliance on individual level theorizing and application of off-the-shelf theories like trans-theoretical model, theory of planned behavior, social cognitive theory. So I will make a side note to say all very relevant theories, right, for understanding individuals and individual level behaviors. Yet in this paper, Moore and Evans argue that often we use these off-the-shelf theories as a safety blanket, and we just apply, and we expect that our interventions are going to be more impactful. And they provide the false assurance that we're going to do better work by using one of these popular theories. Secondly, they argue that we're not always targeting the right mechanisms in our intervention. So there's some evidence that individuals might already have high knowledge or high attitudes, motivation to change behavior, but their environments may not support that change. And lastly, they talk about blinkers or blinders. So how a given theory might prevent us from fully understanding the context or mechanisms that shape and help behavior while guiding us back toward that individual level and often short-term solutions. So some key notes looking forward from this body of literature include the importance, again, of focusing on context, so the need for environmental and population health theory and change methods. Secondly, approaching settings and place with the idea that there are thinking people within systems who often know their context better than outsiders. So the importance of exploring indigenous or local knowledge and co-creating interventions from stakeholders within settings. And lastly, just another concept I'll put out there, a new conceptualization of fidelity. So in research, fidelity often refers to we want everyone implementing our intervention the same way across our schools or across our work sites. This new conceptualization of fidelity recognizes that schools are different, that workplaces are different. As such, we should focus on the function of an intervention, such as delivering a certain minutes of physical activity, and allow the form of that intervention to vary by setting. So now let me talk a little bit about environmental asset assessment and health promotion interweaving into environments and settings. So starting with assessing environmental assets, and let me give a shout out to my co-author, Dr. Sandra Vandenberg, previously Dr. Sandra Evans. So with this approach, we saw the opportunity and need in building from great frameworks like intervention mapping for for a more intentional focus on the environment and how we harness environment and environmental assets for individual health behavior change. So in this paper, we explore a basic settings and environments framework, which I'll share in a minute, to help further inform community health improvement planning. And within this, we build from theory. So we start with social ecological theory with this idea that our health and behavior are shaped by where we live, study, work, pray, and play. Also implementation science and systems science. So the importance of understanding context for health improvement. And then this idea of coupling and embedding intervention with context. And lastly, we explore this idea of environmental asset that we define as any aspect of the multiple environments that surround individuals, policy, social, information, and physical environments that can be harnessed toward promoting the health of individuals and populations, building from the CDC definition of a community asset. So let me just illustrate a little bit how our environmental asset mapping framework works. So we piloted this co-learning and co-creating with out-of-school time educators through an initiative called BOOST, so Boosting Opportunities for Out-of-School Time Physical Activity, Healthy Eating, and Social Emotional Learning. So this was a year-long project, community-based project, where we co-learned about how we might be more intentional about building from environmental assets. So many of us out here, right, are very familiar with ecological models. So ecological models, we talk about an individual level, an interpersonal level, an organizational level, community level, and societal level. So settings and environments frame complements an ecological model, but it conceptualizes that space outside the individual a little differently. We start with settings, with the question of where and what are the settings that can be harnessed to reach our priority population. So in our work with child health promotion, the settings might include schools, out-of-school time programs, faith-based institutions, neighborhoods, and community recreational centers, as well as the home setting. So the idea here is that within each setting, there are different environments. And the key here is how are we best describing and understanding what that space is outside the individual. So there's a policy environment, there's a social organizational environment, there's an information environment and physical environment, pretty much within each setting. Even in the home setting, you can think of parental rules, bedtime rules would be an example of the policy environment. So with our work, we engaged in a workshop type approach with our out-of-school time educators, and we began with just exploring. We didn't come with an intervention saying this is how you have to implement physical activity or healthy eating. We started with learning. What are those opportunities to interweave our intervention efforts into the existing context? So we learned in the policy environment that there is a frontline staff code of conduct. So that could become a great platform for interweaving policy around staff, hey, maybe not drinking Coca-Cola in front of the kids, out-of-school time program family agreements. So that could be a great platform for providing recommendations to families. Maybe you don't send, the family-sized bag of Takis with your child. Here's some other recommendations. Out-of-school time district level policy as well as state level policy on minutes of physical activity. So how can we build from that policy with our work? In the information environment, we learned there's parent bulletin boards, which can serve as a platform for promoting messaging, parent flyer newsletters, school websites, out-of-school time program webpage. In the social organizational environment, we learned that there's in-service staff training. So why create a whole separate training for your initiative when you can build from and interweave into existing trainings? And we learned of other potential social organizational assets as well, including different OST program partners. And then the physical environment, we learned about different spaces within the out-of-school time setting where we could incorporate and be more intentional about promoting physical activity and healthy eating and social emotional learning, cafeteria, gym, school garden, playgrounds, and as well as other physical spaces. So the idea here in building from the good work by Dr. Jim Salas on ecological models is this idea of interactions of influence. So how do we harness these different environments to up the chance that we can shape the environment to shape individual health behaviors such as physical activity and healthy eating? So our second paper on this topic continue to build from this idea, right? How do we harness that environmental space? And this was titled Health by Design, Interweaving Health Promotion into Environments and Settings. And within this paper, we explore this idea of health promotion interweaving as defined by designing health promotion interventions, so strategies, practices, programs, and policies to fit within, complement, and build from existing settings and environments. So it builds again from these concepts of coupling and embedding intervention within context, embraced as an indigenous health intervention development perspective. So building from site-specific knowledge, practices, and values. So the importance of co-creating and co-learning with stakeholders within systems, and moves from a conceptualization of context as a backdrop to intervention to one that recognizes context as integral to the intervention design. So it's not just, I have my magic bullet and pill I'm going to disseminate via settings. It's how we co-create with the environmental context, the intervention. So this paper explored theoretical and practice-based interweaving concepts and methods in relation to the policy environment, the information environment, the social organizational environment, and the physical environment. So first, I'm just going to share a few examples here from each environment. So this was a literature review. We looked at empirical literature as well as the practice-based literature. So in the policy environment, one health promotion interweaving concept that can be useful is health in all policies. So this builds from community planning and municipal planning. And this is this idea that when you're developing a new neighborhood, you're developing an action plan for a school or whatever that may be, that you consider how that may affect health and how you might take advantage of your plan to promote the health of your population. It doesn't mean health needs to be at the center of the plan, but we pay attention and considerations to health. So in our work, back to the good work with Catch Middle School, again, a shout out to Dr. Steve Kelder and others working on that project. We started out that project by trying to learn. We didn't start behind our computer and thinking about existing theory, but we started with trying to understand what was happening in that context. So we worked with awesome community organizers and planners, Casey Hansen, Megan Graylis. And what they noted was in the schools, students were being dropped off at the beginning of school and were hanging out in the cafeteria in different middle schools here in Central Texas. And we thought, hey, this is a great opportunity for creating another opportunity for physical activity. So we created an open gym policy, working in collaboration with teachers and school leaders. So back to that concept of, and this was via an initiative called Get Your 60, which is part of the Catch Middle School project. So back to that idea of fidelity, one thing that we learned through this project was, the power of letting schools also decide how to implement that policy. So in some schools, we learned that when they started their open gym, it was mostly guys coming out and not necessarily allowing space for girls to play in that open gym. So some schools came up with a practice or a policy of having girl-only days. Other schools, in addition or instead of an open gym, they created a walking clubs before school. Others implemented during lunchtime. So different ways that folks implemented that open gym policy. Another example of an environmental asset and how we might interweave into context are campus improvement plans. So these are strategic plans that schools develop at the beginning of each year that pretty much lay out their objectives for their school. So let me give a shout out to Michelle Smith and colleagues at Texas Action for Healthy Kids. In this initiative, led by Michelle, she was successful in inserting policies and practices for physical activity and healthy eating in our 10 key intervention schools in Central Texas, working in collaboration with the leadership teams. So again, an existing platform for policy, an existing and inserting language and focus on physical activity and healthy eating into that asset. Information environment. So now thinking about this concept of environmental print. So I learned about this through my wife, who's a public school teacher. And what I learned is that environmental print is a concept of within child literacy, how children learn to read, right? And they learn to read through everyday contexts, including word walls, right, in their own school. Well, an example, one of my favorite examples here of interweaving into existing information environmental assets is the Agita Sao Paulo program in Brazil, where they inserted physical activity promotion messaging within people's electric bills. So no funds required for the research team, and it reached over 7 million Sao Paulo residents with physical activity promotion messaging. Marijuana use prevention in middle school students. So oftentimes, when we think of health promotion, we think, all right, we need to develop that classroom-based lesson to teach kids why they shouldn't use marijuana. Well, Slater and colleagues took an innovative approach and said, hey, what if we enhance the messaging around marijuana prevention within middle schools via book covers, tray liners, rulers, lanyards, t-shirts, as well as collaborating with a network of nonprofit organizations to further spread their messaging. So using a group randomized control trial, they found less marijuana use at 2-year follow-up in schools with this enhanced information environment compared with a more traditional classroom curriculum condition. One other example, and a shout out here to Dr. Belinda Reininger, who's our dean at our Brownsville campus for the UT School of Public Health, building from this changed method of behavioral journalism, which builds in role model stories. They were able, through the Tu Salud Si Cuenta program, build in role model stories around physical activity and healthy eating, and drive time in morning radio, TV spots, and newspapers working on the Texas-Mexico border, and with positive findings of increasing fruit and vegetable and physical activity. All right, an example of the social organizational environment here. Too many examples. So again, we might think promoting fruit and vegetable, let's get a classroom lesson and teach kids why they should eat more fruit and vegetable. Or we might embrace this interweaving change concept of appropriable organization and common agenda, building from social capital theory, as well as mobilizing social support. So this is the idea of how do we work with existing organizations? So instead of creating a new wellness team, how do we work with the existing PTA, for example? Where our former dean, Cheryl Perry, a leader in adolescent health promotion, in her 5-a-day cafeteria Power Plus, they were able to collaborate with cafeteria workers to have them provide verbal encouragement for children walking through their lunch line for fruit and vegetable consumption. And this intervention was one of the more successful strategies that resulted in increased consumption of fruit and vegetable. Many other examples out there, right, of interweaving into the social and organizational environment. Another one that comes to mind is working with librarians to teach them how to administer Narcan for opioid overdose. Many people experiencing homelessness, public libraries are a key foundation and resource. And so instead of putting a nurse in every library, working with librarians on how they can help be a frontline response. So another example of interweaving into that social organizational environment. Other examples here on structural redesign within the physical environment. So redesigning cafeteria serving lines to promote more healthy eating. Review by Ferrick found that was resulted in increased selection and consumption of healthier foods. Shared use, a practice-based interweaving concept of referring to sharing use of a given physical space. In this case, Tom Farley and colleagues just opened up the schoolyards after school in New Orleans and provided adult supervision. And that resulted in more kids coming out to play, and an unexpected result was more kids playing in the neighborhood surrounding the school. And then a more recent example within COVID, right? Facilitation, which is this method from social cognitive theory, as well as shared use, how to make that healthy behavior the easy behavior. So in Louisiana, they had shot night in bars, where they brought COVID-19 shots and vaccination sites directly to bars. Again, every idea is worth considering here. All right, so let me transition now to how we actually can co-create and co-learn with stakeholders within a given setting. So I'm going to talk a little bit about our work with the youth-led community health learning initiative. So background here, I've had the pleasure, well, first let me back up. So health departments and federally funded hospitals are required to implement a community health assessment and community health improvement plan. I had the great pleasure of working with Austin Public Health and other Austin Central Texas colleagues on the Austin Travis County Community Health Assessment, Community Health Improvement Plan. And in leading a post hoc evaluation with my colleague, Dr. Sandra Vandenberg, one obvious finding we noted was the opportunity for these plans to get closer to communities, right? What a challenge. How do you plan across a whole city or county? So after our first evaluation, we explored further. How do we get closer to communities within Austin Travis County? How do we bring in more youth voice as well? So the aims of this initiative were to identify health needs and assets to inform planning efforts in partnership with two communities, Central Texas communities, Del Valle and Montopolis, and build skills and capacity of young people in implementing community health assessments of health issues identified by youth. And the second aim, I'm just going to cite one of my other models of interest, is the parallel track model. And this is this model that says with whatever community health improvement intervention you're doing, how do you have a parallel track of capacity building and empowerment? And not just for your research team, but for your stakeholders. So now that the way I approach interventions, let's not just focus on that p-value at the end of the project and, you know, whether we found a difference or not, but how are we being intentional about building our skills and learning with every project that we do. So with this project, in good CBPR, community engaged fashion, we started out with putting together a community health advisory committee. Two of our primary partners were Safe Expect Respect program, Barry Rosenbluth, Randy Randolph, as well as Children's Optimal Health with Susan Millay. And we had other awesome partners from Austin Parks and Rec, Austin Public Health, Del Valle High School, shout out to Ms. Amanda Cortez and Nora Sebastian, Dell Medical School, as well as Travis County Health and Human Services and folks from our camp from the UT Health School of Public Health. So we had two key components for the Youth-Led Community Health Learning Initiative. First, our usual suspect methods of starting out with a community health and indicator analysis led by my colleague, Dr. Anna Wilkinson and Dr. Leanne Ganser. And with that, we compared a range of indicators for Montopolis and Del Valle with Austin and with the state of Texas. So here's just an example bar graph where we found inactivity to be higher in Del Valle compared to Austin, as well as in Montopolis. So getting a little academic-y here, we applied a mixed method sequential explanatory design where that builds from quantitative indicators like these bar graphs, then we bring in qualitative research to try to understand better what these findings mean and what these disparities might mean. So we had a great partnership with Del Valle High School. We worked with 19 seniors from their health science track. And we also worked with the Safe Summer Youth Employment Program based in Montopolis with 12 awesome youth investigators. So our methods, we embraced a participatory learning and action approach, which is an umbrella term for a range of participatory methods, but key to them are often group-based and visual type methods. An example is we start out with participatory mapping to learn more about where youth go in their community and where do they go, for example, for leisure time activities. We learned in Del Valle, a lot of youth go to Austin because not as many, perhaps, leisure time activities in Del Valle, yet Del Valle is so key for visiting friends and family. Data walk, so we brought our indicator data and we engaged youth in providing more context to those disparities as an initial activities. We then provided the space for youth to prioritize and select the topics they were interested in exploring more further via a method called Photovoice. So here are the topics in Del Valle they explored: healthy eating, physical activity, access to health services, and sexual and reproductive health, mental health, and Montopolis, ACEs, sexual health, and mental health. So our main method here was Photovoice, and Photovoice, we learned a lot from great folks at YWCA in New Britain, Connecticut, who've been using this method for the past 10+ years. And you often start with developing your framing questions, which are kind of your study questions. So why is X topic a problem in your community? What could your community do to prevent that topic? Importantly, what are ways you could promote the healthy side of that topic? And what are resources or strengths that could be the community can use that can help teens make those healthy choices? So we really try to embrace a strength-based approach, not just focusing on the problem, but focusing on the solution as well. We then used the showed method so we divided students into teams. They went out and took pictures and created narratives. And then we came back and they analyzed using the showed method, then to develop their narrative. So what do you see here? What is really happening? How does this relate to our lives? Why does this condition exist? Where did the issue come from? And what are some things we can do about it? So just an example to get us going here. Many of the youth, again, no PhDs in our group that I knew of, but they knew exactly what some of the key issues were in their community around healthy eating. Not much access to healthy foods, no supermarkets. So this picture aptly titled "Healthy Eating Not" of some of the foods they had access to in their local convenience stores. So as mentioned, we try to have a balance not just on the problem, but what can we do about the problem? So in this narrative, youth share a way to help them or teens make the choice of healthy eating is by not having much junk food close to them, giving them more options of healthy items, having more fruits and veggies in small containers for them to grab instead of a bag of chips. You can spice up fruits. It's better to have a fruit than a bag of chips. And again, very actionable approaches. How do we incorporate these ideas into their existing settings, into their school settings, for example? Physical activity and inactivity. One of the narratives that the youth co-investigators came up with here in Del Valle, there aren't much resources for us to actually get out and do things that are active. Although we do have a lot of open land, that isn't always a reason for us to go outside. Most of us don't have time due to having jobs or not having enough time in the day, right? Time poverty here. Another reason being that there's not much we can do with what we have around us. So balancing, right, with what can we do about this, not just the problem. So one of the very actionable ideas, right, this picture shows a dog running outside. This picture relates to our life because the majority of us have a pet. I took this picture because I think if we could have a dog park with animal activities, this can promote physical activity by people getting their exercises and moving around with their pet. Access to health services and sexual and reproductive health. So here, one thing we learned, right, that it's not just taking literal pictures, it's also metaphorical pictures. And it really is just that photo voice, the voice of youth to understand better the issue. So in this picture, it shows how obtaining healthcare is far away from our community, distance. The stethoscope isn't focused due to people as well not focusing on their own health as they should. The open space in the picture also shows how our community does have plenty of space for a healthcare facility to take place, but the issue is there's no change being done. A key theme from both our youth co-investigators was the need for more focus on sexual and reproductive health. Here, this picture shows a Planned Parenthood clinic that is hidden. The connection is that talking about sex is hidden, and sex is a thing that happens naturally and people are ready. Teens should know the resources that they choose to have sex. If some of our resources are hidden, how are we going to know what we want to do safely if we don't have them available to us? Lastly, we engaged our youth co-investigators in sharing back our findings with our community. So we had an awesome community showcase event led by our youth co-investigators at Del Valley High School. They came into Austin to share their findings with a powerful board of directors from Children's Optimal Health. They shared at the Austin-Travis County CHA CHIP Steering Committee, as well as a community showcase at the Safe Alliance in Montopolis. And we also developed a story map, thanks to the good work by Ashley Levelet and Susan Millay at Children's Optimal Health. So implications for this work. One, we documented the feasibility of high schools to incorporate co-investigators to help us learn. There's a movement, how do we get more population thinking into high schools? We also documented the power of community organizations like SAFE to lead youth-led CHA CHIP. We also identified locally informed and actionable community health improvements. And importantly from this work, shout out to Fernanda Santos, to Nicole Trevino, Fernanda with Austin Public Health, Nicole Trevino Consulting, and other community partners. They were able to build from our findings from this assessment, and we were able to secure a 3-year Office of Population Affairs grant to explore how we enhance the ecosystem of supports for sexual and reproductive health and overall healthy development among youth in Del Valley. All right, last example here is with our work with Stronger Austin. So how this study and this initiative is all focused on how we interweave adult fitness classes into community settings via Stronger Austin's community partnership model. So a little background, there's barriers, surprise, surprise, for physical activity among adults experiencing economic disadvantage. Among those, distance to and lack of access to physical activity facilities, perceived neighborhood safety, as well as lack of social and community supports. In Austin, over a quarter of Austin adults are obese and half do not meet physical activity recommendations. So thus was born Stronger Austin, and one of the overall aims here is how we increase accessibility of free adult fitness classes in underserved communities in Austin. Let me just note, Stronger Austin is more than just adult fitness classes, but we're focused here just on the adult fitness classes. So It's Time Texas is our key host organization. A shout out to Vanessa Castro, who's been our awesome director, Baker Harrell, and Kim at It's Time Texas, founder of It's Time, and Kimberly McNeely at Austin Parks and Rec, key founding partners for this initiative. Austin Public Health, another key partner, my brother's keeper at UT. Bloom Communications and Aging is Cool, a nonprofit here, and the UT School of Public Health. So our approach, how do we interweave Zumba, boot camp, mixed fit, yoga, senior fitness classes into settings with widespread reach? So among the more usual suspects, right, rec centers. Beyond that, though, we also try to bring these fitness classes to city-supported housing, community clinics, libraries, parks, as well as public schools. So again, practitioners out there, nothing new here, just greater intentionality of how we interweave and bring our programming to be interwoven into community settings. So we report here on our first 2 years of the initiative. We had 11 sites in year 1, 15 sites in year 2. Here's not a great map, but you can see where some of our classes took place, and we were in 10 zip codes in Austin and Travis County. So for our evaluation, the UT School of Public Health, building from a campus community partnership approach, we partnered with the good folks, our good colleagues, partners at Stronger Austin. And our aims were, one, let's just assess, how much physical activity is actually being delivered VR adult fitness classes when implemented in these real-world settings with widespread reach and access to the community, and then qualitatively explore highlights, perceived benefits, and recommendations for enhancing delivery of these classes among participants and fitness instructors. So I'm gonna just keep moving forward since we're getting low on time. So let me just share some of our key findings. So we had just under about 1,000 people reached in year 1 and around 800 in year 2, 11 sites in year 1, 15 sites in year 2. About a third of our participants in these adult fitness classes were receiving some type of government assistance, such as SNAP. We had an average of 18 adults, 10 per class, with a range of from 5 to 42 participants. So this bar graph presents data from SOFIT, which is an objective measure of physical activity, which helps one using direct observation to be able to calculate how much time of that class was spent in moderate activity, how much time was spent in vigorous activity, and how much in total combined moderate and vigorous physical activity, or MVPA. So here, for an average, we show data from 4 of our semesters. We tried to assess at least half of the classes and a mixture of our different types of classes for each semester. And we found about 77% to 87% of class time was spent in MVPA, which equates to about 46 to 52 minutes of MVPA. So our recommendations for adults is that they get 150 minutes a week of aerobic time. So if folks attend about 3 classes a week, they will be meeting their aerobic physical activity recommendations. So we also learned about some of the key highlights and benefits. Here I'm almost at the end of the presentation. Thanks, folks, for sticking with me. So among those, right, one of our unexpected findings, we conducted focus group with participants. We also had open-ended survey items, and then we did interviews with instructors. So here, these are findings from our participants. So sense of community was a key theme that emerged. So some participants said, I like the community of people and friends I've made and how the class makes me healthier and want to continue to work out. Others said the community of people was a key highlight, how everyone helps each other even outside of class. Others said diversidad de participantes. So diversity was another key theme, and these classes had a mixture of both English and Spanish speakers. Most of the instructors were bilingual and were very effective in engaging diverse participants. We also heard a key theme of the importance of the instructor, that here one participant said the instructor is an excellent person. She always motivates us. She's very good. The instructor is awesome, and the friends and friendships that I've discovered, and my overall attitude changes. I'm not so shy anymore. Other key themes were about the health benefits and motivation. One person said, I love the class itself. It's a fun way to exercise and keep me motivated to lose weight. So back to that idea of interweaving. So not only were classes intended to engage folks in activity, but to raise awareness about other healthy options and activities within the city. So one participant shared, Stronger Austin classes keep us informed of other healthy events such as farmers markets throughout the city. High accessibility and diversity. This was a key focus of our efforts with Stronger Austin. So we heard a lot about the access. So one person said, love how accessible this was and how came every week. I could once I found out about it. It was so much fun, and I definitely got a great workout. Others said it's fun and close to my house. One of the themes we learned about, though, was folks could go, because of the variety of offerings here, everywhere variety can do something different on every day. Some would go to some classes close to their house. Others would go to classes close to the workplace as well. Diverse schedule, and importantly, a key theme was free. So one participant shared, I would love to be part of all these gyms are all around, but oh my Lord, I can't afford them. I'm so happy that you guys are doing this. It's so awesome. Thank you for caring. All right, just about 2 more slides here. So other just encapsulated Physical activity benefits, diversity of participants from our instructor that summarizes well. So with my students, you can see their overall health and wellness change and fostering relationships with people that they wouldn't normally cross everyday paths with. So different races and cultures, backgrounds, etc. So it's like a good relationship building class and a good workout. Of course, in being a good community health researcher, we want balance. We want to learn too, what are ways we can improve our approach? So we learned class delivery. There's opportunity for, incorporating more progressions and graded intensity levels. We learned there's opportunity for better promoting the class and better communication about the classes. And we learned about challenges with interweaving, right? We have to be open to these challenges along the road, right? So one participant said, when people come to a place that is dirty or super loud, it just creates a very stressful environment for them, and they just won't feel comfortable. Again, when we have dual use of settings, we need to figure out better. As stronger Austin classes that are at parks, so if the weather is bad, they have to cancel a class. And lastly, for us, it's a school. So it's based on the school calendar. The school shut down like for the week of July 4th, and also our classes are canceled. So all awesome input for us to think further, how do we make this experience better, and how do we deal with that duality of these settings that are often used for different purposes. So summary here, nothing so practical as a good theory. A settings and environments conceptual framework, right, holds promise to further guide health promotion beyond, right, in ecological levels. Opportunity, how do we start out? Just like a geologist describes rocks, how does a health promotion environmental scientist describe that space outside the individual? So economic environment, another key environment study just came out. 23% of Latino and 25% of Black households in the Austin Round Rock area pay half their monthly income in housing versus 15% of whites. So that disparity, and also located in space, right? Maybe other places have better equality, something for us to work toward. Racial social equity, right? I haven't touched much on that. Importance of inclusivity versus exclusionary, discriminatory. How do we apply that lens to our schools, our workplaces, our universities, et cetera, and how that shapes our health and behavior. Time environment, learning so much, right? How we use our time. Finland, happiest country in the world. Prime Minister exploring introduction of 4-day work week, right? So if you live in Finland, maybe your health is going to be a little better because of the time environment. And arts and culture environment. So environmental asset assessment, health promotion, interweaving holds promise, right? This is stuff you all practitioners are already doing. What we're trying to do here is create better intentionality with how we plan in concert with settings and environments. An opportunity for growing our theory-based and practice-based change methods, a shout out to intervention mapping, their awesome taxonomy of change methods. We cited some of those here today. How do we continue to build that menu of methods? Building a science of environmental change. I'm going to end here. Considerations of time. One thing we're learning in my community health class based on the literature, environmental change takes time, right, to implement. Maybe it's not going to fit in our 2 or 5 year grant cycles. Study designs, group randomized control trials important, but what are other study designs? Impressed with the work out of Texas A&M in community health and their use of case studies, for example, and dose. How do we increase dose of these environmental changes? Better understanding processes for co-creating change with community stakeholders. And lastly, and importantly, how do we allow our research and practice to focus specifically on environmental change? At a TPH, Texas Public Health Association conference a few years back, I asked a question and had a great response from a community planner who said, if A is in place, B will follow, right? If the policy is in place, environmental change is in place, B will follow. So how do we give ourselves the space to first focus on changing environments and not just individuals? All right, in there with a quote from Ignacio Martín Baró, another hero of mine, social psychologist from Spain, who is a faculty member at Universidad Centroamericana in El Salvador, openly questioned the theoretical methods of mainstream psychology as inadequate to address the effects of structural violence affecting El Salvador. And he said in his writings for liberation psychology, we need to develop a progressive psychology that helps people find the road to their personal and collective historical fulfillment. In our case, more than anyone else's, the principle holds. The concern of the social scientist should not be so much to explain the world as to change it. I'll end here with acknowledgements and shout outs, and I know I've gone way over, but I want to just express great thanks to everyone here on this list. And again, I'm out of time, otherwise I would go through each person, but this work isn't done by oneself, but it's done with awesome community colleagues and partners. So thank you, I'll end here. And thanks for humoring me with staying connected. Let me turn it back to Dr. Ranjit and see if maybe we have time for a couple questions here.
Thank you, Dr. Springer, for that excellent presentation. As always, it was rich with really provocative ideas, and I love that you're harnessing the community to generate ideas for the promotion. So a reminder to the audience, if you have any questions, please enter them in your chat box and I can read them out to Dr. Springer. But while we are waiting for questions, I had a couple of comments on your presentation, Andrew. So I really like the idea of starting with the setting that people occupy and then leveraging possible environmental assets within that setting. But you also, in one of the projects that you talked about, referred to getting the community to provide input on their environments. So is that something that you want to build into your interweaving approach, or is it something that you see as outside of the interweaving approach? The idea that the community itself tells you what the environments, which environments matter.
Yeah, no, thank you, Dr. Ranjit, for that question. I think you hit on two great points. One, so much more opportunity for describing what those environments are and how they can shape us. And two, what I was trying to illustrate with our youth-led approach, I didn't do a great job in showing how some of their solutions are anchored back in these environments. So for sure, to be able to, from my perspective, effectively create environmental change, we need direct stakeholder input from our partner communities to be able to identify where those changes can be made. And one example I didn't get much into, but I talked a little bit about our access to health services. And just as an example of how community stakeholders know their context, we learned from our youth that one of the few clinics in Del Valley didn't have hours on Saturday during our semester that we were working. By the end of our project, and not thanks to our project, the clinic then created Saturday hours. But there, for me, is just an example, right, of folks do know their environment and do know their context. So how do we help activate and harness that knowledge for environmental change?
Okay.
So, yeah.
There's a question from the audience. So this one says, the issue of the day is COVID vaccine hesitancy. What are the settings and environments that you would you target to address vaccine hesitancy? And do you have any hopes for getting input from the community?
Yeah, thank you so much. Excellent question. And, you know, as I have gotten deeper into this and learning, my excellent neighbor and professor at UT at Austin, Sam Woolley, his focus has been on disinformation and misinformation, right? So as I started this work, you know, thinking of the information environment as something positive, where of course we're gonna take advantage of local community channels to promote, learning a lot, right? How we need to combat that misinformation and disinformation. So one, I would, you know, dare say we could start by doing an environmental asset assessment of learning more, what are those communication channels? But secondly, and I'll defer to my other COVID experts, what I'm reading in the literature and the news, the importance of that social environment. So interpersonal influence has become so important for changing vaccine hesitancies as well. So how might we use methods like behavioral journalism to highlight further those role model stories of I was hesitant. Yeah, my mom, came to talk to me about this, or my uncle came down with COVID. So I think there's opportunity to build in from these theoretical methods while understanding further what are local communication channels and where people are getting their information. So thank you for that. Great. And lastly, I'll just say with COVID, for me, that's been a great example. You go to any supermarket, and I can't help but think in terms of environments. There's a policy environment, or at least there was, for mask wearing. There's an information environment in terms of the markings that tell you, where you can go and other signage. There's a physical environment in terms of the plastic guards being put up to protect people. So you can see in microcosms of how different settings are approaching COVID-19 prevention via environmental approaches.
Great answer. Unfortunately, I don't have time for any more questions, so we'll bring it to an end here. As a reminder, this webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. You should be able to access this within 24 hours. Additionally, there will be an email that will go out to all registrants with a notification to the effect. Thank you again for attending, and thank you, Andrew, for your presentation.
Thank you, Dr. Ranjit, and thanks everyone for attending. Have a great rest of your afternoon.